It's been an interesting piece of equipment because we think maybe the protocols and how we look at rehab and how we look at the timeframes can potentially change with how we use the AlterG. A lot of the patients that we've had a lot of success with are patients who have various pain syndromes like complex regional pain, and these patients find it very difficult to get started in that weight bearing process. So with a lot of those patients we encourage them to try to weight bear into pain if they can tolerate it. So a certain amount of pain is expected, but it's very hard for them to do that in a controlled environment. So what the AlterG is, it allows them very specifically to take a wee bit of weight off, enough so that they can tolerate it, but not enough that it causes them a significant amount of pain. Some of our patients, say with a true dislocation of a knee where they've ruptured anterior, posterior cruciate medial ligament, it's not uncommon for those patients to be rehabbed over an 18-month period. And what we're seeing is that by using the AlterG, it may bring 6 months or 9 months potentially off that rehab period because they've been able to weight bear earlier and they've got more function in an earlier stage.
After her first session, there was just a remarkable improvement, you know, even in the colour of her leg, and her confidence increased, and there was a real sort of well-being effect where she felt being able to weight bear on the AlterG gave her the confidence then to weight bear when she went home, and then that weekend she just felt marvellous and has been progressing ever since.
You know, our time's very limited. There's no busy or quiet time in trauma, it's pretty consistent. So, you know, it means that maybe somebody like Paul, who in the early stages may have to wait a week, maybe we're getting them in those few days earlier.
The machine is a diary of its own, so patients that we would normally see a couple of times a week, we have decided that we're only seeing them maybe once a week, and what they've done is they come in on a separate occasion and maybe just use the machine in isolation.
Somebody can be on the AlterG, I can maybe have another patient I'm treating, and then I can almost swap them over. Whereas traditionally if we didn't have the AlterG, then there's maybe not the equipment in here that you could have somebody protected weight bearing.
People who wouldn't normally be able to walk have been walking with it. People who wouldn't normally be able to run have actually been using the treadmill to do things that they wouldn't have planned to do, and their injuries may actually have curtailed them to do.
I think definitely for Paul, like I don't think we would ever have got him running, and normally it's 12 months and you start to see flickers, whereas you know he was getting flickers at 7.5, 8 months. I have another lady as well, and she was told by her consultant that she would never run again. I didn't really have much more I felt I could offer, so I sort of gave her the opportunity to have a few sessions on the AlterG, and she's gone from 50% to 70% within a week and a half, and her knee pain has completely gone away, and she's quite keen now to increase her weight and maybe look at running again, though we haven't told her consultant.
Other colleagues from other areas within the hospital and within the Belfast Trust are quite interested in trialling it with different types of patients. So neurological patients, patients with obesity and weight related problems, patients who have got joint related problems such as arthritis, head injury patients. Also the surgeons that we work with are now prescribing that patients get referred up to use the AlterG, and instead of saying somebody is light weight bearing or partial weight bearing or full weight bearing, they're asking patient is 20% weight bearing and 45% weight bearing and 60% weight bearing. So certainly within the multidisciplinary team, the surgeons are also sort of buying into the idea that they want their patient to put a certain amount of weight through it rather than actually saying partial weight bearing, which could be anything from 5% to 95%.
We sort of have had discussions as well that there's no reason why that this facility couldn't be used, whether that is like privately contracted out in the evenings, because I'm sure people, running clubs or people that are injured would want to use it, and that would potentially be a way of generating income. From what I'm watching on Twitter, there's a lot happening in London, and I think, you know, if it's starting to filter through into the UK and into London, then hopefully it'll get across here.
It's very rare that patients would ask to do fundraising to provide equipment whenever they've been told that the machine is on loan. So I think that's an endorsement in itself, and so I think from that point of view we do have to listen to them as clinicians, and they are telling us that they do feel that this piece of equipment does help and has significantly helped an awful lot of people.
I think £30,000 in the NHS climate isn't an awful lot of money when you consider where money's spent in other ways and the benefit to these patients.
If we can obtain the funds for it, we would be purchasing the unit as quickly as we could.